Morning and welcome everyone. Thank you for joining us. I'm Conan Knoll, Communications Director for Small Business for America's Future, and I'll be moderating this call. First, just an FYI that this event is being recorded. During our call, you'll hear from 3 speakers and then we will have a Q&A. If you would like to ask a question, please raise your hand via Zoom and we will call on you after everyone has spoken. If you have called in on the phone, there is no hand raise function. You can either log in with the Zoom link we provided or follow up with me after the event and I will get you an answer. Small Business for America's Future is a coalition of business owners and leaders working to provide small businesses with a voice at every level of government. And we're committed to ensuring policymakers prioritize Main Street. Special thank you to our partner, Texas Employers for Affordable Healthcare, for joining us today to discuss the results of our latest survey. We recently surveyed 1,015 small business owners in our network about the impact and causes of high healthcare costs. And today we're going to focus on what more than 150 small business owners from Texas said about those rising costs and how hospital consolidations are contributing to them. To discuss the impacts on small business, you'll hear from Dr. Erica Gonzalez, who runs a private practice and is a leader in the San Antonio Hispanic Chamber of Commerce. And you'll hear from Chris Skizak, the Executive Director of Texas Employers for Affordable Healthcare, who will discuss HB 711, which is legislation that addresses the high cost of healthcare. But first, Small Business for America's Future's Senior Healthcare Policy Advisor and a former official with the U.S. Department of Health and Human Services, Emily Barson, joins us to highlight some of the results of our survey.
Thank you, Conan, and good morning. The high cost of healthcare has long been a top concern for small business owners. Rising healthcare prices not only strain small business budgets and eat into their bottom line, they also impose undue hardships on the dedicated employees who make small businesses thrive. In an increasingly competitive labor market, offering health insurance benefits is essential to attract and retain top talent. If a business owner can't afford to offer it, they risk losing good employees to competitors that do. The impact of high prices is significant. Our surveys have consistently shown that small business owners raise the prices of their goods and services to offset healthcare costs, and that significant numbers have delayed growth opportunities or held off on hiring new employees. For this survey, we focused on one factor that drives high healthcare costs: hospital consolidations and pricing. It's a trend that is accelerating across the country and right here in Texas. Nearly half of Texas survey respondents said they have seen hospital consolidation in their communities, and many say this leads to less choice for care, longer wait times, and fewer services, in addition to driving up healthcare costs overall. Specifically, 85% of Texas small business owners in our survey said that the consolidation of hospitals in their areas have made the overall availability and quality of healthcare services in their communities worse. And 82% of small business owners say that hospital consolidation leads to a lack of competition, making hospital services more expensive for employees and eating into their pay. It's no wonder that 86% of Texas small business owners surveyed said it's important that federal and state governments intervene in the consolidation of health systems. Small businesses can't afford inaction. Nearly all survey respondents agreed that because of consolidation, hospitals are unfairly charging high prices, leading to high healthcare costs, and it's time for state and federal officials to take action. Now I would like to introduce Dr. Erica Gonzalez, who holds a lot of titles. She is CEO, President, and co-founder of South Texas Allergy and Asthma Medical Professionals, or STAMP, and STAMP Clinical Research, co-chair of Small Business for America's Future, and past chair of the San Antonio Hispanic Chamber of Commerce. As a doctor and small business owner, she has a unique perspective on healthcare prices and hospital consolidation. Dr. Gonzalez?
Thank you very much. I really appreciate it, Emily. So one of the things that we are seeing is that healthcare cost does not seem to be discriminating. And even as a medical professional, I'm finding it very difficult to keep up with the prices as they're increasing. And I'm not alone. There's about 3 million small businesses that make up half of all of the that employ half of all Texans. And so, that proves that we are the backbone of the state's economy. I employ 37 people, and as our team keeps growing, healthcare gets more and more expensive, and it's really cutting into the bottom line. I'm seeing very many small businesses, especially the mom and pop businesses, that are being priced out of their ability to offer health insurance to their employees. And the hospital consolidations and unfair pricing are big contributors to the problem. The cost of healthcare is holding back their ability to invest in the growth and the financial health of their businesses. And this is why so many small businesses don't even offer health insurance. It's just too expensive. When they do offer it, the coverage may still be too expensive for some employees who then will opt out. We can all agree that a healthy workforce makes a strong economy, but the high healthcare cost makes this incredibly hard to achieve, yet the hospital consolidations continue. I've seen so many of my colleagues sell their practices to major hospital groups because it's hard to compete. It's not only limiting choice, especially for people in rural Texas, but also causing the cost for basic services to go up. Small business owners understand that competition is good for prices and innovation. And we also understand, as the survey's results show, that the lack of competition leads to higher prices and lower quality. And in the case of healthcare, the lack of competition is having devastating consequences. We know that it's a major driver for the cost of health insurance, and we know that there are personal impacts as well. I've heard so many stories from small business owners who are afraid to get treatment because they're afraid of what that bill is going to show at the end. And no one should have to be worried about those type of things when they're in a vulnerable state, when they're sick, in need of care, or when it's one of their children they're just trying to take care of. It's critical that lawmakers do something to regulate the hospital consolidations. And it's hurting not only the health of Texas, but the health of our small businesses and the health of our economy. Thank you, Emily.
Great. Thank you, Dr. Gonzalez. Next, I would like to introduce Chris Skizak. He is the Executive Director of Texas Employers for Affordable Healthcare, and he will provide an update on active legislation in Texas and solutions to address rising healthcare prices in the business community. Chris?
Thank you, Emily, and I really appreciate this this opportunity. Just a bit about Texas Employers for Affordable Healthcare. We were established last year to mobilize employers and their families and other stakeholders in Texas to rein in excessive prices for healthcare. Nearly half of all Texans, 14 million, get their health plan insurance through their employers. We want to increase transparency. We want to prohibit anti-competitive contracts in billing, and we want to increase oversight over consolidation and mergers. Just as way of background, I am a healthcare scientist, received both my master's and doctorate from the UT School of Public Health, but I wound up working in the employer space for 25 years before having the opportunity to lead first the Houston Business Coalition on Health. And I say that because we represent about 1.5 million employer-sponsored lives in Texas. And what we have learned through the RAND hospital price transparency studies is that employers in Texas in aggregate pay about 250% of a fair price Medicare rate for the same service at the same hospital by the same physician. Furthermore, research done by the National Academy for State Health Policy, or NASHP, shows that there's no need for this. Employers have long been led to believe that they pay more for healthcare because of the shortfalls due to Medicare, Medicaid, the uninsured, and charity care. The NASHP report shows that this is not true, and that when one looks at the break-even price after all costs are looked at and examined, employers are paying upwards of 200%, 100 to 200% of this. And we're not saying that what the price should be, but we are saying that there needs to be more transparency in this so that employers have a fair negotiating a seat at the table. So specifically, we are working right now to pass House Bill 711. In fact, it is being debated as we speak right now. You may have seen a link for this. As I understand, it hasn't started. More than welcome to look at that. But what House Bill 711 will do, it was introduced by Representative James Frank out of Wichita, District 69. And he introduced this bill to try to improve competition, as Dr. Gonzalez said. To have a free market, we need transparency, we need competition, and we need consumer awareness. So specifically, what House Bill 711 does is it prohibits these anti-competitive language in contracts between health plans and hospitals. And what we're talking about, and there are several, one is anti-tiering, which right now prohibits your ability to develop your networks based on value, price, and quality. Another is anti-steering, which prohibits the ability of the health plan and others to steer towards the best value providers. Again, price and quality. And the last thing that it does is prohibits gag clauses that prohibit employers and their intermediates from seeing claims data so that they can better understand value. So that's a short synopsis of 711 and why we think it's important for employers. So with that, I thank you for that opportunity.
Great. Well, thank you, Chris, and thank you, Erica and Emily, for your insights. Now is the time that we can have some questions for our panelists. If you do have a question, either use the raise your hand function on Zoom and we'll call on you, or feel free to put your question into the chat as well. All right. All right, one more time. If you do have questions, let us know. We'd be happy to answer. Put your raise your hand with the Zoom function, or put your question in the chat. Or if you you have questions later, please feel free to reach out to me and I will connect you with the right person to talk to. All right, well, seeing no questions, I am going to bring this call to an end. Thank you to our participants for your insights onto how healthcare and hospital consolidation is affecting small businesses in Texas. Again, if you have any questions or would like to follow up, please feel free to reach out to me, Conan Knoll from Small Business for America's Future, and I will connect you with the appropriate people or provide you any information that you need. Thanks again. Have a great day.